Hello everyone, today I'm going to explain the pathophysiology of my patient, the snake bite. The suspected snake was cobra here. So the venom of the cobra contains neurotoxin. So neurotoxin can impair the acetylcholine binding receptor and block calcium and potassium channels, which leads to the impaired synaptic nerve impulse transmission. When there is impaired in transmission of nerves impulse, it can lead to the failure of motor nerve impulses also. So it can lead to different kind of nerves, but in my case, in my pathology, I'm connecting it with the motor nerve. So why? Because when the motor nerve doesn't work well, when the transmission of impulse and motor impulse are not good, it can lead to muscle dysfunction. So when there's muscle dysfunction, it can also lead to rhabdomyolysis, which is like breaking down of the bone components, and the bone components, after breaking down, it enters to the bloodstream and it can cause compartment syndromes. So my patient have risk for compartment syndrome. And then muscle dysfunction means there are different kind of muscles in our body, and the muscles which are important for the respiratory functions like respiration are diaphragm and intercostal muscles. So when the impulse of motor neuron is not normal or not adequate or not functioning well, so muscles are also not functioning well. So when the muscle doesn't function well, diaphragm and intercostal, which are important for the expansion of lung during breathing, so when the diaphragm and intercostal muscles are not functioning as they should, it can lead to the poor ventilation, because due to which it doesn't allow the full expansion of lung. So when there is no full expansion of lung, so we cannot breathe properly, so it can lead to the poor ventilation. So when there is poor ventilation, we have to turn on the ventilator. The ventilator setting of my patient was CPAP, PEEP5 and FiO2 0.4. So my patient had risk for hypoxia related to poor ventilation. And then next, due to the failure transmission of nerve impulses, it affects the sympathetic nervous system. And how it affects is that it decreases the sympathetic tone. The sympathetic nervous system, the main function of sympathetic nervous system is to increase the blood pressure when it's low, but due to the decrease in sympathetic tone, it does the opposite way. The blood vessel, they dilate and it leads to the low BP. So it also leads to the bradycardia and low BP, and due to which the patient was administered norepinephrine, which is inotropic drug, which is used to increase the heart rate and decrease the BP. That's why my patient, after the administration of medicine, my patient have pulse tachycardia, which is 116 bpm, with premature ventricular contraction, which means like the ventricle, they contract before the blood enters into the ventricle, and it can lead to the heart damage or cardiomegaly, or in future it can also lead to cardiogenic shock and cardiac arrest. So my patient also have risk for cardiogenic shock. And due to low BP, when there is low BP, the systematic vascular resistance also decrease, and when the systematic vascular resistance decrease, it can lead to the shock, which is called neurogenic shock. And another cause of low BP is the low BP can increase, it can stimulate baroreceptors. So baroreceptors, one of the function of baroreceptor is to produce ADH. So ADH is antidiuretic hormone. The function of ADH is to reabsorb the water in the body. when there is deficit water in our body. So here, when ADH is increased abnormally, it can cause fluid retention and urine concentration. Due to the ADH, increased ADH, we have fluid retention in our body. At the same time, the urine is concentrated because urine don't have enough fluid, so concentration of urine is high. So that's why my patient have orange color urine with 200 to 400 ml. Less than 400 ml, we say oliguria. So due to this, we have risk for volume overload. My patient have risk for volume overload, and another risk factor my patient have is during the sputum culture, my patient have gram-negative bacteria which produces endotoxin. This toxin causes the inflammatory responses, due to which it due to the inflammation there is rupture of alveoli and the necrosis in the lung. So due to which my patient have necrotizing pneumonia, and at the same time, due to infection and rupturing of alveoli, there is immune response, and there is also suppression of immune system. So due to which due to infection, my patient have fever, mild fever, which is 38.3 degrees Celsius, and WBC is also high. Neutrophil is also high because the immune system is fighting against the infection. So due to the inflammation, my patient also have soiling at the right leg and left hand, and due to which my patient was given hydrocortisone to calm down the immune system. So because if you don't calm down the immune system, it can cause autoimmunity and it can destroy its own cells and cause complications. So that's why my patient was given hydrocortisone, and that's why my patient have risk for septic shock. So we have to take care of the patient to prevent the septic shock. So the next underlying disease my patient have and the risk factor is liver cirrhosis. The function of liver cirrhosis is to take out all the toxins from the blood, but when the function of liver decreases, it cannot take out all the toxin in the blood. So the hematotoxin, the toxin in the blood, they get accumulated more and more, and when there is toxin in our body, it can overactivate the coagulation cascade, which is the main source of platelet and fibrinogen. So when due to which the platelet and coagulation are overused, and it causes the decreased platelet which is 82,000 in the patient, and due to overactivation of coagulation cascade, it can lead to the coagulation, like disseminated intravascular coagulation, which can also lead to thrombosis and formation of which can also lead to thrombosis and formation of clot in our bloodstream, and it can also lead to cardiogenic shock. And another thing that DIC can cause is hemolysis of RBC, damage of RBCs, due to which my patient's hemoglobin level is 8.2. So when it is decreased, the function of hemoglobin is to carry the oxygen to other parts of body, but my patient doesn't have enough hemoglobin, so it means reduced auto carrier in my patient. So the assessment I have here is capillary refill time. So it is more than 3, which means the blood circulation is not good, and there is reduced auto carrier, and which is also the cause of hypoxia, which can also cause the hypoxia. So my patient have risk for hypoxia related to, as I told before, poor ventilation and then capillary refill time. So and another thing I forgot here, sorry, platelet is reduced. The function of platelet is to clot the blood, right? So when the platelet are very low, the patient have high risk for bleeding. It can be internal bleeding or maybe like external bleeding also. So we have to maintain aseptic technique, and we have to also keep the environment safe, because if the patient bleed due to the low platelet, it will be very hard to stop the bleeding, and it can also lead to, when there is bleeding, it can also lead to cardiogenic shock, cardiogenic or maybe other, like septic shock and cardiogenic shock. So that's why we have to be very careful. So that's why one of the caring for risk for bleeding is also very important in diagnosis. And here thrombocytopenia means decrease in platelet. And due to the muscle, sorry I forgot here also, muscle function impaired, like when there's muscle dysfunction, it can lead to paralysis due to the neuron, because our brain is connected to the other parts of body by the motor nerve for the movement, especially for the movement is motor neuron. So when the impulse doesn't reach from one motor neuron to other motor neuron, so our body cannot function as our brain want. Like we move our hand because our brain tells us to move the hand. So but in this case, nerve transmission is impaired, so patient have risk for paralysis. And also due to the muscle dysfunction, we have low magnesium here, electrolyte, which can cause electrolyte imbalance. So magnesium because in muscle, magnesium, it helps in relaxation of muscles, it works. So like when the muscle doesn't function well, so it can also cause the decrease in magnesium. So that's it for my pathology, and hope you guys understood it, and thank you for listening.